Sean bienvenidos a un capítulo más de Sobre la Mesa, en donde discutimos temas de actualidad en el foro de CITIC 2025, este gran congreso que sin duda ya es un referente nacional de cada año. Y tenemos ahora la gran oportunidad de contar con uno de los grandes representantes de la cardiología intervencionista mundial, y es el doctor Mamas, quien es profesor en la Universidad de Keele en Londres, en donde dirige el Centro de Investigación Prospectiva, y además es un activo intervencionista y una gente muy activa y profesor y organizador del comité científico de CITIC. Dr. Mamas.
Thank you. It's a real pleasure to be here.
Thank you really for being here again.
Yes.
You're a visitor each year here in this Congress, and we're always waiting for your talks and your expertise. And, you know, I want right now to get you to bring out your crystal ball.
Okay.
And with all your experience, I want to know, what do you think in where are we going to be in interventional cardiology in the near future? Let's say 20, 25 years from now, in terms of pharmacology, imaging, technology, artificial intelligence, and so on. What do you see in the near future in interventional cardiology?
I think now is a really exciting time to be in cardiology, and I think it's a really good question that you ask of me. I think that cardiology is going to develop in maybe 3 or 4 areas. I think the first area that we're really going to see advances on is prevention. I think that's really important. I mean, after all, we're sort of doing secondary practice because we're failing to prevent the development of atherosclerosis. I think it's very exciting now, particularly in advances in lipids management, in identification of risk, particularly lipoprotein A. We're getting more understanding of its central role in the development of atherosclerosis. We're getting a much greater understanding of how to intervene pharmacologically in this arena. So I think we're going to be much better at, number one, detecting early atherosclerosis, both invasively and non-invasively, and number two, preventing both its development and progression. I think the second area that's going to be very exciting is to think about once you have atherosclerosis that's developed, is to think about, well, okay, which are the plaques or diseases that we should intervene upon? At the moment, we're using very blunt tools. We use an angiogram, we look at luminal narrowings, we may even use hemodynamics, but we're getting a lot more developments now, say in cardiac CT, looking at factors on the CT, such as perivascular fat inflammation.
Non-invasive.
We're using intravascular imaging, understanding parts of the plaque that make the patient more susceptible to disease. So I think, going forwards, we're going to have much better algorithms in terms of trying to decide when we should intervene, who we should intervene, and how we should intervene. I think the final point is around the application of data. At the moment, we have randomized controlled trial data, and we have information from this data at the population level. And that's really important, because at the population level, you may have an intervention that shows efficacy. But if you look at the individual patients within that population, on average, most of the patients are going to have benefits, some won't though. And so I think now we're starting to move to a more personalized approach. And we're doing this in a very blunt manner. So for example, with antiplatelet regimes, we're saying, okay, is this patient high bleeding risk? Well, okay, we can probably reduce antiplatelet duration shorter. Are they high ischemic risk? We should probably use more potent antiplatelets. I think now that we're collecting information all the time through angiography, non-invasive imaging, CT, electronic patient record, we're going to start to be able to incorporate all this information and use artificial intelligence to guide our decision making. And yesterday I had a really good discussion around the concepts of digital twins. And digital twins is an in silico representation of the patient using artificial intelligence, whereby you can predict what will happen to the patient in silico before you do any procedure. So you can say, well, okay, if I do, use drug A or procedure A, this is what I predict is going to happen to the patient. If I do procedure B or drug B, this is what's going to happen. So then you can really, with these digital twins, you can really at the individual patient level, use artificial intelligence to predict what will happen in different scenarios and then choose the most appropriate scenario in that patient in real life. So it's an exciting time.
I really love it. I mean, you went back to the essential, that is prevention.
Yes.
And that is really interesting. Instead of trying to go ahead in technology and try to intervene more, the future should be to try to intervene less and prevent the disease. So it is a fascinating concept. Thank you very much, Mamas. That was really, really enlightening to say that. Y señores, ahí tienen. La prevención es realmente lo que deberíamos estar haciendo en el futuro en el término de la cardiología intervencionista. Muchas gracias por su atención y quedamos atentos para un nuevo episodio de Sobre la Mesa. Mamas, thank you very much.
No, thank you. Pleasure. Thank you.